Hello, welcome back to our usual lecture note discussions and presentations. Today we are going to discuss about management of febrile convulsions. Febrile means that there is high body temperature, most probably above 38.5 degrees Celsius, and convulsion is the person is having tonic clonic seizures. Our learning outline will begin by definition of febrile convulsions, causes of febrile convulsions, clinical features of febrile convulsions, differential diagnosis for febrile convulsions, investigation is done in febrile convulsions, and then the treatment of febrile convulsions. Febrile convulsions are generalized tonic-clonic seizures associated with a rapid rise in temperature, and this is always due to an extracranial illness. It commonly affects children who are between the age of 3 months to 6 years, and mostly it is always due to infections that are always outside the brain or the extracranial, and they result in rise in temperature, resulting in convulsion. Common causes of febrile convulsions include malaria, respiratory tract infections, urinary tract infections, and other febrile conditions. Clinically, a patient presents with elevated temperature, that is temperature above 38 degrees Celsius. There is always convulsion, which is usually brief and is self-limiting it is always less than 5 minutes, and most times it is always, even if it exceeds 5 minutes, it is always less than 15 minutes. However, these convulsions tend to occur in case the temperature remain high. So these convulsions come in when the temperatures go high, and they can resolve if the temperatures are reduced. However, if the temperatures keep high, convulsions tend to recur. However, there is no neurological abnormality in the period between the convulsions, and these convulsions are always benign, and they have good prognosis as long as the temperatures have been reduced, or they have been taken to lower levels, or they have been maintained to normal values. The convulsions can stop happening and the patient recovers to normal life. Differential diagnosis for febrile convulsions can include epilepsy, brain lesions, meningitis, encephalitis. You can also include trauma, or in cases of trauma and head injury. Other causes can be hypoglycemia. If in case there is an intracranial pathology, it can also cause febrile convulsion. So most cases it is important to clinically exclude it, especially in children who are less than 2 years, and you should consider a lumbar puncture or treat children empirically for meningitis. Investigations done in febrile convulsions include, for example, blood slide or blood smear, and mostly that is used to rule out malaria, that is Plasmodium parasites. You can also do a rapid diagnostic test to rule out malaria. In addition to that, you can also do blood glucose levels to assess for and rule out hypoglycemia. You can also do full blood count to rule out infections and assess for the levels of leukocytes. A lumbar puncture and CSF analysis may help you in ruling out meningitis, encephalitis, and the other causes of meningitis. Treatment of febrile convulsion: the first stage of treatment is tepid sponging to lower the temperature. You get a piece of cloth, soak it with cold water, and then use it to massage and mop the heated body. And then you also give antipyretic, and preferably paracetamol, that is 15 milligrams per kilograms every 6 hours until the fever has subsided or reduced. And if the patient is convulsing, you can give diazepam, that is diazepam, 500 micrograms per kilograms, and the maximum dose is, in this case, is 10 milligrams. If the patient is unconscious, remember to position the patient in the recovery position, that is making him sleep on the side, and you ensure that their airway is patent and the patient is breathing, and their saturation, that is in form of blood pressure and the pulse rate, are normal. Prevention of febrile convulsion is through majorly tepid sponging to help in lowering the high temperatures, and through administration of paracetamol, which is an antipyretic, to help lowering the body temperatures. Thank you for your time. Thank you for tuning in. I hope this presentation has given us an insight on how to manage febrile convulsion. See you soon and good luck in your studies.